There's been a lot of confusion around the new drug for Alzheimer's, lecanemab, so here's why it's a big deal, and why it's not. The brand name of lecanemab is Leqembi, and it received full approval from the FDA in July after the publication of the Stage 3 double-blinded placebo-controlled study back in January. Leqembi is a monoclonal antibody, meaning that it binds antigens at a very specific site. It's also a humanized antibody, meaning that it was initially obtained from other animals, but then was genetically modified to better resemble human antibodies. In Alzheimer's, a protein called beta amyloid abnormally aggregates within the brain and causes damage to neurons. Leqembi works by binding the soluble protofibril form of amyloid beta, which experiments have shown is more toxic to neurons. This then flags the abnormal protein aggregates for removal by the immune system. Because lecanemab is an antibody, which is a type of protein, it would be degraded in the stomach if taken orally, so instead it's administered by an infusion every 2 weeks, and the infusions tend to last about 1 to 2 hours. In order to qualify for this study, participants had to exhibit mild Alzheimer's, meaning that they had some symptoms, but those symptoms weren't severe enough yet to significantly interfere with their activities of daily living. Participants also had to have confirmation of Alzheimer's pathology using either a special type of brain imaging called an amyloid PET scan, or through doing laboratory tests on cerebrospinal fluid obtained through a lumbar puncture. Drumroll please. The study showed that over a period of 18 months, the participants who received lecanemab infusions had about a 30% reduction in the progression rate of their Alzheimer's. Participants who received lecanemab also had about a 60% reduction in the amount of amyloid beta within their brain based on those amyloid PET scans. However, recall that Leqembi works by directing immune cells across the blood-brain barrier into the brain in order to clear amyloid beta. As a result of this necessary inflammation, the drug was unfortunately found to cause brain swelling and bleeding in some patients. The risk was highest for patients who were taking a blood thinner like apixaban or patients who had 2 alleles of the gene ApoE4, so if you fit into either of those groups, you wouldn't be a candidate for the therapy. As a short aside, ApoE4 is actually the largest genetic risk factor for adult-onset Alzheimer's. ApoE has 4 different alleles, E2, E3, and E4, and patients who have 2 copies of the E4 allele are about 40 times more likely to develop Alzheimer's and may develop it slightly earlier in life. Due to the risk of hemorrhage and bleed, patients receiving lecanemab are monitored regularly using scheduled MRIs, with additional MRIs as needed for developing symptoms. Although brain swelling and bleeding sound scary, about half of the patients who develop those MRI findings don't even have any symptoms, and the remainder have mild and temporary symptoms like headache or confusion. If we run into side effects, then we either pause the therapy until the MRI findings resolve, or we stop the therapy entirely. Because the original study only lasted about 18 months, it's a little bit unclear about what to do after that period, but general practice has been to repeat an amyloid beta scan. If the scan has turned negative, then we stop the therapy because studies suggest that after that point, the infusions won't be very helpful. So in summary, the availability of this new drug makes it more important to catch Alzheimer's early on, because the drug is only beneficial at that stage of the disease. However, there are some big caveats. For example, recall how patients who are taking blood thinners or patients who have 2 copies of the ApoE4 gene aren't candidates for the therapy. Also, it only slows down progression by about 30%, and although more insurances are beginning to cover the therapy, the frequent infusions and MRI scans can become expensive and limit travel.